Hey, my wife Kathy just got back from the grocery store harvesting accoutrements for a fine meal. And while she was in line, she picked up a magazine, Consumer Reports, and the title got my attention: What Doctors Wish Their Patients Knew. Don't you want your patients to get this? But when I turned it over and I saw the next article, which was about how to buy a car, I wish I had done that earlier because I think I paid over the price I should have. Anyway, back to today's topic, and that is about patient compliance. One of the things about studies that we get, whether it's from the AMA or from the chiropractic genre and academia, is that sometimes it misses exactly what's going on in the mind of the consumer. Sometimes our political groups and sometimes our institutions more or less institutionalize and hardwire their own ideas and forget to talk to the consumer of healthcare. So that's why I think it's good not to come down from our high horse, but just to look across at articles in magazines that the people are reading, your patients, your target market. So it's an interesting study. I mean, we could go on and bore you with studies about patient compliance in all kind of other more stringent, strict academic findings, but let's see what the people are saying. So what they did in this consumer magazine, what they did is they took 660 primary care providers and surveyed them, and they took 49,000 Consumer Reports subscribers, and they found that there were some highlights when they did the survey. And one of the highlights was that doctors and the patients alike look at favorable interaction as something they value. They look at cooperation, courtesy, and professionalism. Both patient and doctor appreciate that, of course. The second thing that came up for the doctors was patient non-compliance with recommendations and treatment regimes. They felt that interfered greatly with the patient's response. That's not unknown to us. And the other one was that not knowing much about the doctor's personality up front before they went to meet and to engage in a doctor-patient relationship. Of course, we at DC Mentors think that is mostly the responsibility of your chiropractic team and you to be able to adopt, adapt, and read the other people, the patients who come in, so that you are taking care of your half of the relationship. The other big point, of course, is this non-compliance with the advice, and that 37% of the doctors surveyed, and probably if we surveyed you, we would find that 37% of us would say that it greatly interfered with our ability to help. We might even take a higher method. The other piece that's important here is that to appreciate what the people said about compliance. And one of them was that it was hard at times to comply because it's no longer just taking a pill. Even if it's in a medical professional relationship with the patient or a chiropractic patient, there's still lifestyle changes that need to be made in order to accomplish a healthier, longer, more vital life. So it's not just us, it's against them. It's an appreciation that the chores, the self-care chores, I mean, people look at exercise, they look at dietary changes, they look at those as work, and we need to make them not so work. We need to get them to do incremental change in order to hit that tipping point. The other point of non-compliance is that people, quite frankly, some of them are hopelessly disorganized. Some of your patients are hopelessly disorganized. I hope that's not you. And then the other piece is pretty simple. They don't feel any better. And we are all of us are in the feel-good business. So if the person is not getting a response from the chores, getting the response from your adjustments, not getting a response from a change in lifestyle, they're likely to not comply. And of course, the other issue is they sometimes have adverse reactions. Of course, with medications, we know that the list of adverse reactions far exceeds the list of the things that you want to fix. But let's look at chiropractic. Sometimes adjustments make people sore. Sometimes it puts them into a frightened mode. And of course, sometimes we go in there and just say, well, I'm glad you hurt more. That's a sign you're getting well. Well, it might not be a sign that they want to hear and appreciate and understand. They will need to hear your take on it in a more compassionate, empathetic outlook. Not hand-holding, but creating an understanding. And the thing is that we are in the getting results business. So what can we do? We can investigate with our new people. We can find out what we think they need, bare minimum, in the sense of getting at least from this point to this point, not from complete chaos and crisis to complete wellness, but how do we have incremental changes? Not a bait and switch, but a step-by-step plan for them, something where they know they can follow up on, and they are getting a certainty from you that if they do comply, they will get the response. So that's where we investigate, we inform, and we influence. We need to have our thoughts, our appreciation of health, healing, and restoration accepted in a way and heard in a way that they can appreciate and understand.